I'm going to move on to another set of what I call orphan tumors. No one really owns them, but they're out there. And I'm going to focus most of my talk on the surgical management. The multidisciplinary management of sarcomas is controversial and confusing, and every institution has their own protocol, which is the only and the right way to do it. But the surgical management, I think, is much more concrete, and there are some principles that definitely should be followed in all cases. We're going to start off with our case. So let's visualize this 60-year-old female who presents with flank pain for 6 months, a very typical presentation, otherwise relatively asymptomatic. Eventually, her PCP gets a CT scan, and she shows up in your office with a scan that looks like this. So what would you do for this patient? CT-guided biopsy, laparotomy with a biopsy, laparotomy and resection, external beam radiation, or chemotherapy? Okay, great. So the first question, to biopsy or not to biopsy? I think most people would say in a resectable retroperitoneal mass with little diagnostic uncertainty, you don't really need a biopsy. You would be justified to go into surgery. This is what I was taught. This is, if you're from a certain generation of surgeons, similar to the case with pancreatic cancer where you have a mass that is clearly abnormal, but biopsy keeps coming back negative, you're okay in going ahead and operating with this patient. However, there are certain caveats. I think, first of all, if you're going to get a biopsy, it should be a core biopsy, especially if there's any diagnostic uncertainty or if it's going to change management. Your radiation oncologist, your medical oncologist will not initiate treatment in most cases without a tissue diagnosis. An important point to take away is an exploratory laparotomy to obtain a biopsy should almost never be performed. Not only is it a source of morbidity for the patient, there's a better way to get a biopsy, but you are in real danger of violating the tumor pseudocapsule in obtaining a surgical biopsy. If you are going to do a biopsy, a retroperitoneal approach is best. You're not violating, again, the abdominal cavity or the peritoneal lining with the subsequent